everyone, and welcome to PHAMCAST. It's Margaret Wallis Duffy, and I am solo today. I'm missing my other half. I'm sorry that Megan's not here, but we could not wait to have this particular guest in studio. I am humbled and honored, and are you ever in for a treat today? You know how much I love preventative and integrative health, and you know that I believe in a better together as one philosophy of care. And today, I get to sit down and have an in-depth conversation with a physician whose story is incredible, whose philosophy is aligned with mine in this preventative health movement. And so without further ado, I'm going to read his impressive resume before we dive into this conversation, so stay tuned. I got to put my glasses on so that I can properly do justice to the person who's in studio with me today. Dr. Hannah is a physician investor with expertise in endocrinology, hypertension, genomics, and longevity medicine. Currently, he is an academic professor of medicine and an endocrinologist and geneticist at the University of British Columbia. His passion lies in empowering consumers with access to cutting-edge technologies in precision medicine such as artificial intelligence, genomic medicine, and Healthspan advances. He is a medical advisor for venture-backed companies like Eli Health, Nexus Healthcare, and Science and Humans. In this capacity, he provides valuable insights and guidance, leveraging his medical expertise to continue to contribute to the success of these innovative ventures. Driven by his commitment to advancing precision medicine, he founded Healthspan Digital, a health tech specializing in precision health and longevity medicine, and dedicated to building longevity biomarkers and clinical programs for the health, fitness, and even real estate industry. He helped launch the Middle East's most comprehensive longevity program at Lifespan Clinic, and extending those services to gyms and large community residents for a vertical, integrated, and holistic well-being healthcare system. Through Healthspan Digital, he aims to provide individuals with personalized and proactive healthcare solutions utilizing the latest advancements in precision medicine. And that is exactly why I'm honored and excited to start this conversation. Dr. Hannah, welcome.
Thanks a lot for this kind intro, and it's my pleasure to be here, and I'm excited to talk to you about proactive, preventative, and personalized healthcare.
Yes. You know, when we first had a conversation, right away, I just knew that our missions were aligned. This whole preventative health movement, I mean, it really is starting to become more in the consciousness of all people, including healthcare professionals. But I want to tell our listeners and our viewers a little bit more about your jump from being an endocrinologist to now what you're doing today.
Yeah, well, I still practice endocrinology at the University of British Columbia. I enjoyed my time dedicated to traditional healthcare models, but I found an opportunity to bring in innovation in the sort of newer, more exciting healthcare models, which include being more proactive and seeking to live a longer, healthier life. This concept of health span, which is how can we live a long, healthy life away from chronic disease and disability. And while endocrinologists are longevity and health span doctors by training, by default, we really are not trained to look at the individual from a longevity and preemptive, proactive, preventative lens.
Right.
And when I came across this very exciting field of healthy longevity, which is the subspecialty of medicine that is focused on preventative care, focusing on biologic ages, biomarkers of aging, and to try to sort of tweak the individual to live a longer, healthier life through preventative means, got me really excited. And so I revisited what I wanted to do, which is to introduce innovation to this Medicine 3.0 preventative, proactive healthcare. And it's very exciting to be in it. I see it as a continuum with our traditional healthcare model. I think our traditional healthcare models are very important in providing urgent, emergent care. We save a lot of lives through traditional care models, but I think there is a greater opportunity for practicing and scaling proactive, preventative, longevity-focused healthcare models so we could live a longer, happier life.
Well, and for all of you listening, this is exactly why you're sitting across from me today, because that is exactly, from my own experience. And we were talking about this, and many of you listeners know about my personal health story and where it started as a young girl, being, not diagnosed with the disease for a very long time and really suffering. What I love about what you're doing is bridging the gap, not only for your colleagues in conventional and allopathic medicine, but you're also really empowering and bridging the gap for everyday people and patients. From your experience, I'm sure you see this all the time. Physicians don't have time. The work, I have tremendous respect. If it wasn't for, allopathic medicine, I wouldn't be speaking to you. Like you said, when I needed that surgery, when I needed that nasogastric tube, thank goodness that was available to me. But equally, and as profoundly true, if it wasn't for stocking my toolbox with complementary strategies and technology to help me get into the driver's seat of my health, I wouldn't be speaking to you either. I'm one of the first people in Canada to have a fecal transplant with Dr. Thomas Louis because I almost died from a hospital-borne infection. How are you finding it now, wearing the lens of also speaking to the patient about taking some ownership and changing the mindset? Because let's be honest, a lot of onus is placed on the healthcare system to take care of us. Whereas the lens that I like to look at this in is, yes, the healthcare system's there to take care of us, but we also have to be the CEO of our health. How do you manage that as a physician?
Right. Well, today consumers have access to information and choices. And we're seeing trends in consumers coming to us with a lot of noise that they learn from social media platforms and celebrities that are empowering our clients, consumers, patients with various consumer products, which gives them an important choice. So I think we have to play an important role in understanding the products and services that are out there beyond the traditional products that we are trained in, to ensure that we know how to talk to our clients and patients about these products, to understand their limitations and merits.
Right.
I would like to see it as a continuum, and for us to learn and understand beyond the traditional care models, we need to invest in our education, time, energy, efforts, and understanding the spectrum of products and services in healthcare today.
Right.
And it's not limited to the traditional regulated products.
Right.
It's a wild, wild west out there. And some of these products do actually work for the individual in creating personalization. And so I want to work with my clients. I want to approach their interests, the products and services that they bring forth with a very open mind. And I do invest time in trying to understand, how best to guide them through this journey. And so I think my recommendation is to be open-minded.
Yes. And how is I'm going to candidly ask this. What has the feedback been from some of your colleagues? Are you seeing a change, or are you still being faced? And I know this is a complex answer because
Right.
it's not a simple solution, and there's also a lot of fear associated with being boldly doing things differently than everybody else is. What are your colleagues saying? What's been the response from some of your colleagues to this kind of approach and mindset?
Well, it's a spectrum. Some of my colleagues are very comfortable with the existing model and they don't want to sort of think outside the box. And I've got colleagues that are very much interested in leaving the existing model towards the more proactive, longevity-focused models of care. And I've got colleagues that are hiding in the closet and are very fearful of incorporating these solutions for various reasons. It really depends on the individual and their appetite for innovation and change. My appetite is to empower my consumers and my clients and patients with cutting-edge access to technology so we could harness the power of technology for personalized insights, data-driven care. And my focus is to help create a bridge between the traditional healthcare models and the proactive, preemptive, longevity, personalized models through technology. And we're in such an exciting time period today where we can introduce these innovative technological tools for the betterment of our patients, community, population, and overall global health.
Yeah, and our system, because our systems are strained and access to care is challenging because of that strain. And I do believe, and I don't know if you could weigh in on this, I do believe there's been a bit of a mindset shift with the average, let's just talk in North America. I think the pandemic really did, from my perspective clinically, for people that I was treating through the pandemic and beyond, there was an opportunity, although it was a very scary time, it did sort of open the eyes to a lot of people that, wait a minute, I may not have access to care the way I was used to, or I may not be able to see that specialist because I've got a long wait time to get to see that specialist. And before there was a sense of entitlement that I just needed to go to you, the physician, to fix me or to help fix me. But there wasn't that ownership on ourselves, where the pandemic made us stop and realize, well, wait a minute, I need to take some ownership. But here was the hard part. They don't know how, because the education is not there. The resources are not there, and the support is not there. So when you talk about bridging the gap and being open, I want to scream for the rooftops and first of all say thank you, because this is exactly, for 32 years, what I've been, the way I've been living my life from a practitioner perspective, wanting to learn from you and you learn from me, but most importantly, putting that patient or that client and having them be the most important member of their healthcare team, because they are. And have you found there's a shift in the mindset where there's more of an appetite, maybe out of necessity, but also out of excitement that there is a different and maybe better way?
Absolutely, Mark. Well, the whole field of medicine has shifted from sort of the older paternalistic way of doing business to more of personalization. But it's not adapting very quickly to the rapid innovation that's out there today.
Yes.
And so consumers today are left with a lot of choices, but they don't know who to go to seek the right answers. I mean, we as healthcare providers should be the go-to place for understanding the interplay, the limitations, and the opportunities of these different consumer-focused products and services. And I'll give you an example. Now, proactive healthcare is embedded in our traditional healthcare models. You know, proactive cancer screening, colonoscopy, mammogram, DEXA scans and other related scans for osteoporosis screening, hemoglobin A1C measurement in certain at-risk populations. I mean, we do have proactive care models that are embedded in our traditional healthcare systems, but they don't screen for everything because of the limitations of our screening tool and the economics behind practicing proactive healthcare for every single disease. We know that most cancers don't have the appropriate screening tool today.
Right.
So there's a big push for full body MRI scans or liquid biopsy blood testing for early cancer detection. And we're seeing this as a consumer product trend. We're also seeing interest from the venture capitalists and the investors in pouring money into these very interesting longevity tech-focused companies on building solutions to build products and services for conditions that are not met by the traditional healthcare systems. Now, we need data at the end of the day. We need to understand whether these innovative, new, proactive approaches will help save lives and will help the economy save money in terms of healthcare costs.
Yeah.
We don't know. So we need long-term studies and a lot of dollars to get to those answers. But we can't wait for decades of research until we get those answers. Consumers are frustrated today, particularly after the pandemic. They want answers. They want innovation. They want to have access to early detection tools and services. And so I think that we're in a dilemma today. Should we promote these sort of poorly studied products and services, or should we not? And you know, at the end of the day, I think that we should all develop our own personalized approach to how we approach these consumer products away from our traditional system models. What I'm seeing as a trend is medical tourism outside of Canada. People are going elsewhere to seek regenerative therapies like stem cells, full body MRIs, and or a $20,000 longevity assessment in the Bahamas or Dubai.
Right.
I think we need to understand what the consumer needs and help educate as much as possible, but not be a barrier.
Right, exactly. There's so much to continue talking about. So we're going to take a break here in a second, and we're going to come back and we're going to talk a little bit more about what can you do as the patient, as the consumer? How can we help stock your toolbox so you can feel empowered and have some of that access? Because you're right, we are in a dilemma. But dilemma's the only way to push through a dilemma is to be disruptive. And that's what this conversation is about. So stay tuned, because we'll be right back here in a moment at PHAMCAST. Stay tuned. We'll be back.